I'm here now with Sherry Hanrahan, who is the BSN Program Director and an Assistant Professor at Bellin College at the School of Nursing. And Sherry, I want to just start off by asking you, what type of impact do you think this rule change is going to have?
I think it's going to have an excellent impact. Obviously, the emergency rule is meant to help with the nursing shortage, nursing faculty shortage, and it doesn't decrease the standards of a nursing program, but it allows the nursing programs to have a little bit more flexibility while still maintaining standards.
So how can a nurse who's looking to make this change qualify to teach, and how would that person fit into the existing program as far as what they can do and what they cannot do?
A great question. Not every nurse who is practicing can apply, would be acceptable for a position underneath this emergency rule, but they still do need to meet the outcomes or the expectations, such as being an active registered nurse, have a bachelor's degree, have at least 2 years of clinical practice, and there's some additional requirements such as either being enrolled in a master's program or completed some of the master's courses, or have a nursing certification in their area of expertise. Now, nurses who are practicing nurses who have certification have to have at least two years of clinical practice. They have to sit for certification exam, which is a very tough exam, and they also have to demonstrate continued education over the period of renewal, which is about 5-year renewal. So the nurses that this emergency rule is targeting are those nurses who are very highly qualified to provide clinical teaching for nursing programs without decreasing the standards.
Is there anything they can't do in this role?
This is only for clinical practice. It's not addressing classroom teaching at all, and there's still oversight from a nursing faculty who is master prepared or terminal degree prepared. So they'll still be working very closely with the nursing faculty from the academic settings.
Will this actually solve the problem of vacancies, or is compensation the real factor here?
Well, obviously compensation is a factor. I think if you talk with any nurse or nurse educator, we do what we do because we're committed to it. But it also does allow more opportunity, more flexibility from a nursing program director who just went through many interviews to try to hire clinical faculty for upcoming fall and spring clinicals. It can be very challenging trying to meet those expectations when we also know that there's expertise right in the clinical setting. And this is not new. This emergency ruling is not new. Underneath the emergency ruling in the past, we have been allowed to request approval for a BSN faculty or a nurse who's in a graduate program but who had not graduated yet. It's a one-time emergency approval, and we've had some excellent nurse educators or nurses who provided education for the students in the clinical setting, but they didn't have that master's degree. So it's not new, but again, it allows for more flexibility to help us with meeting those clinical needs.
How many vacancies do you have right now, and how many do you expect to fill through this new pathway?
Well, to be honest, we've been very lucky at Bellin College. We have an excellent graduate program for nurse educators, and we have used a lot of our educator students to fill these clinical needs. And so, like I said, I've just interviewed about 5-6 people and filled up our clinical needs for this next or this fall clinical rotation. We still have needs for spring. With the increased enrollment, which it's really exciting, we've never seen as high numbers as we have seen for the interest in our nursing program. It also requires a lot more nursing instructors in the clinical setting. We at Bellin College, our clinical groups are between 6 to 8 students, and we try to keep it more 6 to 7. And if we have 90 plus students, that leads a lot of clinical needs for clinical faculty. So the needs right now that we do have for the spring are more of those specialty areas where we have great great expertise in the clinical setting, and so it'll be exciting to be able to have this flexibility and not always request an emergency need.
Speaking of enrollment, how many applicants are typically turned away because there is this teaching shortage?
Well, at Ballin College, we have been very lucky, like I said. I don't think we've turned down students at this point. They might not have availability. I know we got kind of close at the end, and then they move over to the next admitting session.
Well, will this change allow you to immediately increase your enrollment caps, or are you limited by physical placement, physical clinical placements in local hospitals?
Well, it'll be interesting in spring when our largest group is going to be starting in the clinical setting. The need for all those clinical placements is going to be very hard to navigate, but I must say that our clinical agencies here in the Brown County area have been amazing trying to support that extra need. And all the academic settings and all the healthcare agencies, we all really work closely together to be able to increase our needs and still work together to educate our nursing professionals.
Would you support this becoming a permanent rule? And if so, what changes do you think are still needed?
Absolutely. Like I said, we have already been using it. I think the biggest difference that I've seen some of the our partners who have agreed with it, we have the administrators of Wisconsin Nurse Educators, WNA, Wisconsin Nursing Association, the Hospital Association. We're all supportive of this. The one thing that the ruling did include was the certification, and not a lot of nurses are certified in their area of nursing. I mean, some precepted nursing instructors have 30 years of experience, but maybe they don't have a nursing certification, but they're very well qualified, extremely qualified to educate our next group of professional nurses.
Sherry, I appreciate you taking a few minutes to speak to us today.
Well, thank you very much.